The treatment of today is quite different than the treatment in the past. But like any other medical approach, I start with interview. I interview the patients about his tinnitus, about possible factors that contributed to the tinnitus, and the general health. Among the factors of tinnitus today, important factor is the medications that patients are taking, especially patients that are over 60 years. After that, I summarize the formulation of what should be done at this stage, and I refer the patients to complementary tests. If there is any suspicion that in imaging, such as CT scan, MRI, audiogram, which is not imaging, auditory brainstem evoked potentials, there is any hint that there is structural pathology in the brain, I refer the patient to experts that will investigate it. But if everything shows that the structure of the brain and the auditory system is normal, I'm looking for factors that cannot be observed in these additional tests. And what is left usually is to refer the patient to blood test, urine test, stools. Everything is according to his medical history. And on the basis of the results, I'm trying to see if there is any additional medical condition that should be treated. Some of the clinical conditions are clear-cut diseases according to any textbook of internal medicine, such as hypothyroidism, diabetes, and some of the findings are what is called subclinical medical conditions. For example, somebody can have normal glucose in the blood in the morning, but during the day the results are pathological. So there are other ways to find whether he is suffering from diabetes. So these two classifications of medical conditions are detected by the blood test. But I can say that about 95% of the patients have abnormality in their metabolic profile, but in some of them, after they receive treatment directed to the metabolic abnormality, the tinnitus remains the same. So it is not so simple, and if there is a failure to treat them, I have to do re-evaluation, reassessment, and continue and do better evaluation of their condition. Sometimes there is abnormality, but it is not relevant to the tinnitus. But in most cases, I believe that there are few factors at the same time. Let us say 4 to 5 medical conditions that each of them is in a very small degree. And that's why the patient is not diagnosed as suffering from other medical conditions, only tinnitus. And if I treat one factor out of 5, maybe the rest of the factors are so strong that he is not cured yet.